your second week there, you look on the list in the mornings, and you see you're on the ride for either the morning or the afternoon. And then for the next 3 weeks, my second, third, and fourth week there, once a week we'd ride, and I looked forward to it probably more than just about anything else there. Yeah, it was by far probably, if not the best, one of the best programs they had there.
Equine therapy is where we use a horse. Most people do not realize that the horse itself is a true, honest addict. They're addicted to the sugar and the sweet feed, and they demonstrate bad behaviors for their drug of choice, same as humans. So we set up a lot of different scenarios and demonstrations with the horse that plays out in front of the patient, to where it's a visual aid and the patient realizes, dang, I do the same thing as that horse just did. So it's a huge visual aid.
We use the horse here for, like during the groups, as a metaphor, for the addiction. They see how their addiction lines up with the horse's behavior, we use a sweet feed as, like the drug of choice for the horses. And so they see how the horse reacts to the feed, and they can see that that's the way they act towards the drugs in their life and all. That part of it is, I guess you would say the therapeutic value as far as seeing, the addiction side of it. But then the riding side of it is it's like relaxing for them.
Before you can be qualified for horseback riding, you have to show that you can get on the horse, and then some rudimentary skills such as forward, backwards, stop, left and right. That's basically it. So that was my first ever even being close to horses. Did that. I did do a couple of the training exercises. Those were optional, and a lot of times there was something else that I chose over those, but I did do one of them. And then after that, your second week there, you look on the list in the mornings, and you see you're on the ride for either the morning or the afternoon.
Part of what, when we go through our riding assessment portion of our group, and that's, they have to do a riding assessment before they're cleared to go out on the trail rides. But we're sitting here and I'm kind of going over the different rules, and a lot of those are clinical rules that transfer over from, the other side of the lake. And they kind of have a strange look on their face. I'm like, yeah, I know, we're sitting in an arena floor right now, but we're still in a licensed medical facility. So when they come down, it is kind of an escape. They kind of get the classroom and the office setting a lot, and that's great, and there's a lot of good therapy that goes on there, but this is kind of a release from that, an escape from that, and they get to come down here and get to see things in a little different light.
Think about therapy as a whole, for a moment. They say that it really doesn't matter what technique that a therapist or counselor uses. It's more about the person that they are and the relationship that they develop with the client that makes therapy so effective. And I think that the horses do that very, very well. We like to joke and say the best counselors we have on campus have 4 legs. How horses are wired, just the type of animal that they are, people bond to them very, very quickly.
We're all species on this planet, and we're all trying to survive and get by. And I see when people struggle, we're people, we're supposed to help other people. That's what we do, that's how we survive. The horse itself has to have each other to survive. They don't do good alone. They need pasture mates, things like that, just for their mental well-being. They're not designed, same as we are not designed. We need each other. And in active addiction, it causes so much isolation and withdrawal in the human. It does so much damage. So this brings them out of their shell, and they're around people. They're around animals, and they start living in society again.
It's a wonderful program. I think it helps Oxford stand out from a lot of other facilities. You've got to do the horse program. It's awesome. It's one of a kind, and I do use some of the skills I've learned there, but it has the potential to change someone's life. I mean, just that one program.